America faces a crisis. It is not a war across borders, but a battle within our own bodies. Obesity, once a concern, has ballooned into a full-blown epidemic by 2025. The statistics are alarming. They paint a grim picture of a nation struggling to manage its weight and consequently, its health. This isn't merely about appearances, it's about lives being cut short, burdened by preventable diseases. We are in the throes of a public health emergency that demands immediate, comprehensive action. The American lifestyle, once admired, is now scrutinized under the harsh light of its consequences. Our dependence on processed foods, our sedentary habits, and our increasingly stressful lives have created a perfect storm for obesity. This crisis impacts every facet of our society, from skyrocketing healthcare costs to dwindling productivity and a growing sense of despair among those struggling with weight. The issue of obesity is complex and multifaceted. It's about the choices we make, the environments we inhabit, and the systems that shape our lives. Blaming individuals for their weight misses the larger point. It ignores the intricate web of factors that contribute to this crisis. We need to shift our perspective. We need to view obesity not as a personal failing, but as a societal issue that demands a collective response. This requires a fundamental change in how we approach food, health, and well-being in America. The numbers tell a sobering tale. By 2025, over 45% of American adults are classified as obese. This translates to nearly half of the adult population grappling with a condition that increases their risk for a plethora of health issues. The prevalence of childhood obesity is equally alarming, hovering at an unprecedented 25%. These children are not just at risk for immediate health problems, but are also more likely to carry this burden into adulthood. These statistics are not just abstract figures, they represent real people facing real consequences. Obesity is a significant risk factor for chronic diseases like type 2 diabetes, heart disease, stroke, certain types of cancer, and osteoarthritis. The burden on our healthcare system is immense, with obesity-related medical costs soaring into the hundreds of billions of dollars annually. Beyond the financial strain, there's an immeasurable human cost. Individuals struggling with obesity often face prejudice and discrimination, impacting their self-esteem, mental health, and overall quality of life. The emotional toll of living in a society that often equates thinness with health and worthiness can be devastating. These numbers are a wake-up call. They underscore the urgency of addressing the obesity epidemic. Ignoring these statistics is akin to ignoring a ticking time bomb. We must act decisively and strategically to reverse this trend and safeguard the health of future generations. The roots of the obesity crisis run deep, intertwining with our modern lifestyle and the very fabric of our food system. We live in a society that encourages consumption and discourages physical activity. Our cities are designed for cars, not pedestrians. Our jobs often keep us tethered to desks, our leisure time dominated by screens. The food we consume plays a pivotal role. Our supermarkets are overflowing with processed foods, engineered to be hyper-palatable and addictive. These foods, often laden with sugar, unhealthy fats, and artificial ingredients, are designed to keep us coming back for more, hijacking our body's natural hunger cues. Socioeconomic factors also contribute significantly to this complex issue. For many, particularly those living in low-income communities, healthy, fresh food is simply inaccessible or unaffordable. These food deserts are often saturated with fast food outlets and convenience stores offering cheap, calorie-dense, nutrient-poor options. Stress, too, plays a role. In our fast-paced lives, many turn to food for comfort, often choosing highly processed, sugary foods that trigger a cascade of feel-good hormones. This creates a vicious cycle of stress eating, weight gain, and further emotional distress. Addressing the obesity crisis requires us to unravel this intricate web of contributing factors. It's not just about individual choices, but about creating an environment that supports healthy living. The obesity epidemic's impact extends far beyond individual health, casting a long shadow over our economy and society. The financial burden is staggering. The cost of treating obesity-related diseases puts an immense strain on our healthcare system, driving up insurance premiums and diverting resources away from other critical areas. The workplace also feels the impact. Obesity-related absenteeism and reduced productivity translate to billions of dollars in lost revenue for businesses annually. Employees grappling with weight-related health issues may be limited in their ability to perform certain tasks effectively, further impacting productivity. The social implications are equally profound. Weight bias and discrimination are pervasive, affecting individuals in their workplaces, educational institutions, and social circles. This can lead to social isolation, lower self-esteem, and mental health issues, further perpetuating the cycle of poor health and well-being. The obesity crisis demands a comprehensive, multifaceted response that addresses not just the symptoms but the root causes. It requires a societal shift that prioritizes health and well-being, empowers individuals to make informed choices, and creates an environment that supports those choices.